Headaches are extremely common. I think everyone will have a headache in their lifetime occasionally. One person out of 20 people in the world will suffer from headache every day. The headache is more common in women compared to men. The commonest cause of headache is tension type headache and migraine headaches. There are two types of headache. One is called primary headache, other one is called secondary headache. Primary headaches are those headache like tension type headache, migraine headache, cluster headache, and other common headaches. The secondary headaches are those headaches actually the dangerous cause of headache, like brain tumor, bleed in the brain, like a stroke causing headache, and an infection in the brain causing headache, or a sinus infection also can cause headache. Dental infection can cause headache. Any headache which is not primary is called secondary headache. So it is very important to find out what is the type of headache. Primary headache is usually a benign, and the secondary headache we actually have to watch out for it if there is any life-threatening problem which can come because of secondary headache. I think this is a very important question. I think everybody has headache at least in their lifetime. So you can't go to the doctor every time. The most important is if you had a headache in the past and you get a headache which is totally different from the previous headache, which is not fitting into you usually get headache for half an hour, you go to the bed and you take rest and the headache goes off, or you just take one pill for the headache and the headache goes. But now you are getting a headache which is the change in the frequency of headache or duration of headache or severity of headache. You should consult the doctor immediately. The second thing is you might not have had any headache in your life, or very less headache, like whenever you get fever you get a headache, or whenever you get cold you get a headache. But if you get a headache which is severe, that you never had this type of headache in your lifetime, this is a bad and the worst headache of your life, this is the headache we should never neglect and should go to the hospital immediately, so that we will not miss a life-threatening problem which can cause catastrophe. And if you have a headache which is associated with any vision problem, for example you are seeing double vision, or you have a headache with fever, vomiting, and you feel you are dull, you are not taking food properly, it can be a infection in the brain. And if you have a headache, whenever you get up early morning, you get up with headache and you have a vomiting, you feel dull, you are not as fast as before, you should always consult. It might be a headache because of increased intracranial tension. It may be because of brain tumor. Or if you get a headache where you have a headache and you have a loss of vision, or a vision is coming down, or you are not able to see properly and you see double. So these are the cases where you have to come to the hospital immediately. Or when you have a headache and you have a problem, for example headache is there and you have a weakness of the hand, you are not able to move properly, or you are not able to mix the food properly, that means it is not only headache, you have a hand weakness. These are the problem. If you have a headache plus something, weakness, you have vertigo, that is giddiness, you have a difficulty in speech, you are not able to hear, not able to see. If this headache is associated with this, I think you should consult a doctor immediately. The first and foremost treatment for migraines are to prevent triggers. That means usually the migraine comes because of the trigger. What are those triggers? Those triggers are very important because you can prevent those triggers. The first and foremost, loss of sleep or disturbed sleep in the night, or sleeping very late in the night, or oversleeping. So if you oversleep also it can trigger the headache, and if you have a lack of sleep it can trigger the headache. So you have to have adequate sleep between 6 to 8 hours. That means 6 to 8 hour duration in the night you should sleep. Early morning, most of the people now skip their breakfast. So when you skip the food or a breakfast, you know that you are sure to get an headache. So when you travel, while going you might be going normally, but while coming back you might get an headache. So traveling should be avoided unless otherwise you have to travel every day. So make sure that other triggers are prevented. We have seen a lot of patients comes and tells me, sir, whenever I go to the function, like while going I'll go normally, but while coming back I have a headache. So avoid going to the crowded place, avoid going out in the sun. So go in the evening, use an umbrella. There are people who say that, sir, whenever I take ice creams or chocolates, I get headache. So simple thing is to don't eat ice cream or chocolate, or ready to take medicine if you eat ice cream and chocolate, because these are all the triggers. So if you can write it down in paper, so this is what happened to me when I got an headache, like the maybe half a day before the headache happened, you write it down. So what food you ate, what did you do which might have triggered the headache. So you see for 3-4 times when the headache comes, so you see which is common. So then those are the triggers. So you have to identify the trigger and actually avoid triggers, so which is the most important treatment for migraine. So second thing is medications. There are 2 types of medication. One is you take medicine only when you have a headache. Second medicine is you take medicine to prevent the further headache, called prophylactic medicines. See, prophylactic medicines are various medicines are available. Like we have a beta blockers, we have an antidepressants, we have an anti-epileptic medicines which can be used for a migraine. But these medicines are given to patients who have headache 2 or 3 times in a week, which is not controllable by medication, and because of this their daily activity is lost. For example, if there is a working woman or working man is there, 3 days he gets headache, he is not able to perform, the productivity is less. Or a child or an adolescent who is going to the college or a school, if they take off 3 days, the productivity goes off and they'll be losing their school. So these patients actually need treatment. So treatment is usually for about 6 months. So we will decide which medicine to give depending upon the patient's types of migraine. Is it a migraine associated with tension type headache? How is their mood and how is their sleep? And usually you should take for 6 months. About 30% of patients will have very good response to the headache. They don't get the headache in their life, but remaining 70% might get headache whenever they stop the medicine, or they might not become better with medicine. Those patients, we might have to change or shift the medicine from one medicine to other medicine. So the most important thing is find out your triggers and avoid triggers.